has been a godsend to me personally and professionally.
This had been a dream for Michael Cunningham's for years to open up these clinics and get involved in the schools.
He'll do whatever it takes to help us get what we need.
While I was working for the Department of Children and Families, what I saw was there was a lot of people coming in need. And the one thing that they could not find or receive was health benefits. There's some federally qualified health centers here, but there's really nothing focusing on the pediatric services that are most needed. The Florida Keys is a very unique place. A lot of times you'll see these million-dollar mansions, million-dollar yachts sitting out in the harbor. But then what you don't see is the trailer parks. You don't see those who are unemployed.
It is a very diverse and economically disadvantaged, in many cases, clientele for our students.
When you're focusing on basic needs, food, clothing, and shelter, healthcare, of course, is one of the first things to go. And we thought that we could do better, by focusing on our kids. And that moved us into the primary care project.
We were able to provide some limited amount of space in our schools, and Mr. Cunningham did the rest, essentially, in providing us highly qualified personnel in the terms of physician's assistants, and allowing our students who literally had no access to health care to receive not just nominal health care, but high-quality health care from these individuals.
A child may walk in who has something more serious going on, like diabetes or a kidney problem that they had no idea. We are able to see and treat and resolve whatever issue it is that they came in for.
There's a lot of families who wake up in the morning with a sick child and they really have no place to go. And it gives them the opportunity to walk in and be seen. And what's different about what we do here is your traditional school health services do not diagnose and do not provide treatment, and that's what we're able to do.
I mean, he already had it. This is back in January, but in the future...
Have these services available to us, no appointment necessary, to them to be so, on site is amazing because it's one less thing that we have to worry about, and that's the most important thing we do worry about is the health of our children.
These kids would otherwise not be getting seen by any kind of provider, let alone physician.
The biggest thing about Michael Cunningham is simply he cares. And in particular, I think he cares about students.
Michael looks at the vulnerable population and where he can help out through education and health.
We're making a difference in the lives of these kids, for these families. We're doing something that nobody else is doing in this community. And, that's where we get the satisfaction from.